again to our channel Bioholic with your Friday educator Olivia. So guys, this is the 6th part of the chapter Locomotion and Movement. I think you have watched all the 5 previous parts of this chapter. This is the last part, and in this video I will discuss the disorders of our musculo-skeletal systems. That means the disorders related to our skeletal muscles and joints. Okay, so let's start today's class. We know that there are 2 main systems of the body that helps in our locomotion and movement. Those are the skeletal system and muscular system. I have already explained everything about the skeletal system and muscular system in my previous videos. If you have missed those, go to the playlist of locomotion and movement. You will find all the videos one by one there. Okay, but there are some disorders that affect either one of the systems or both at the same time. And today I will tell you what kind of disorders are there that occurs in our skeletal muscles and joints. First of all, the osteoporosis. I think you all heard about the term osteoporosis. What is osteoporosis? Osteoporosis is a condition in which bones become weak and brittle. In this condition, bones are degraded, causing it to loss of bone tissue and a low bone mass. Consequently, the person turns exceedingly susceptible to fractures. So in this case, bones become weak. Here you can see the differences between a normal bone and the bone during osteoporosis. And osteoporosis can be caused due to a variety of reasons such as low peak bone mass, imbalanced hormones including testosterone and estrogen, thyroid problems, kidney diseases, anorexia, and obviously low calcium diet and lack of vitamin D. Calcium and vitamin D are essential for proper bone development and strength of bone. So lack of calcium and vitamin D leads to weakening of the bones. And there are typically no symptoms in the early stages of osteoporosis. But once bones have been weakened by osteoporosis, you might have signs and symptoms that include back pain caused by a fractured or collapsed vertebra. Bone becomes thin, weak, and loses elasticity and strength. Therefore, there is loss of height over time, and sometimes a stooped posture develops, a bone that breaks much more easily than expected. And broken wrist and hip fractures are very common in osteoporosis. So how the osteoporosis can be prevented, or what is the treatment for osteoporosis? First of all, you have to do a regular exercise. Then proper protein intake should be there, and proper calcium and vitamin D intake is very much important. And lastly but not the least, you have to maintain your body weight. That's why the pressure on the bones will be reduced, and therefore the fractures in osteoporosis or weakening of bones in osteoporosis can be prevented. Clear? Another important musculoskeletal disorder is the arthritis. It's a very common disorder. It is a condition of inflammation of one or more joints, causing pain, burning sensation, and stiffness that can worsen with age. Arthritis can be of 3 types mainly: the osteoarthritis, rheumatoid arthritis, and infectious or septic arthritis. What is osteoarthritis? It is the most common type of arthritis, and it is associated with the breakdown of cartilages in joints. Commonly, it occurs in the weight-bearing joints of the hips, knees, and the spine. And what about the rheumatoid arthritis? It is a chronic inflammatory disorder that can affect more than joints. The condition can damage a wide variety of body systems, including the skin, eyes, lungs, heart, and blood vessels. Here, the body's immune system attacks its own tissue, including joint lining, causing painful swelling. An infectious or septic arthritis is a type of arthritis that occurs when bacteria or viruses or any kind of microorganisms get into the fluid between joints and then multiply. Thus, infection occurs. This inflammation is referred to as infectious or septic arthritis. So here you can see this is the normal knee and the knee when you have osteoarthritis. This is the septic arthritis, where microscopic studies found varieties of microorganisms, mainly the bacteria. And in case of rheumatoid arthritis, swelling takes place. Now the prevention of arthritis. Obviously, you have to take medications. Sometimes the patients have to administrate the corticosteroids, and physical therapy sometimes reduces the effects of the arthritis, and in severe cases surgery is needed for arthritis treatment. The third important disorder of musculoskeletal system is the gout. What is gout? Gout is painful arthritis formed on the joints of the big toe. It is usually caused by the presence of high level of uric acid in the blood, which crystallizes and settles in the body. And it causes an inflammation and a kind of redness swelling in the joint tissues of the big toe. And gout can be prevented by intake of proper diet, maintaining the uric acid level, and medications. Next, the tetany. Tetany refers to a condition in which the nerves become overstimulated and cause involuntary contraction of muscles and results in the spasms. And it can be caused due to a variety of reasons such as malnutrition, hypocalcemia, hypoparathyroidism, alkalosis, hypokalemia, low levels of vitamin D, excess intake of alcohol. Tetany can be prevented by intake of proper diet. Calcium supplement should be given to the patient, and sometimes in case of alkalosis, isotonic fluids should be administered. Next is the muscular dystrophy. Muscular dystrophy is a group of inherited diseases that damage and weaken skeletal muscles over time, and this damage and weakness is due to the lack of a protein called dystrophin. That's why this disorder is named as muscular dystrophy. This dystrophin is necessary for normal muscle function. Mostly, muscular dystrophy has a hereditary origin. The muscles fail to regenerate, resulting in progressive weakness. The symptoms of muscular dystrophy generally manifest themselves in children, though certain forms of the disease do not surface till adulthood. The general symptoms include poor balance, inability to jump or run, waddling gait, deformation of the calf, trouble in getting up from lying or sitting position, and inability to learn from others. And there are mainly 9 types of muscular dystrophy which vary in symptoms, age of onset, severity, and rate of progression. Some are named after the muscle they affect. Here you can see the 9 different types of muscular dystrophy. If you want detailed information about these types of the muscular dystrophy, then let me know in the comment section. I will make a video on muscular dystrophy where I will elaborately describe all the types of muscular dystrophy in details. And the prevention or treatment of muscular dystrophy includes high protein diet, therapies, medications, and proper exercise. And lastly, the myasthenia gravis. Myasthenia gravis is a type of neuromuscular disease that occurs due to the development of autoantibodies against the receptors acetylcholine in neuromuscular junction. It is characterized by grave weakness of the muscle due to the inability of neuromuscular junction to transmit impulses from nerve to the muscle. In this case, body develops antibodies against its own acetylcholine receptors, and these antibodies prevent binding of acetylcholine with its receptors or destroy the receptors. So though the acetylcholine release is normal, it cannot execute its action. And it can be treated by the administration of cholinesterase inhibitors such as neostigmine and pyridostigmine. These drugs inhibit cholinesterase, which degrades the acetylcholine. So acetylcholine remaining in the synaptic cleft for a long period can bind with its receptors now. Here you can see what happens actually. The autoantibodies prevent the acetylcholine to bind with its receptor. And sometimes it also destroys the receptor. Thus, acetylcholine cannot bind to its receptor. So that's all about the disorders related to musculoskeletal system. If you have any queries, you can ask me in the comment section or you can directly mail us. The mail ID is provided in the description box. In the next class, I will discuss the NEET questions related to locomotion and movements along with their answers. Also, there will be a mock test on this chapter, and today's self-assessment test link is in the description box. Don't forget to appear in it. And if you find this video helpful, please like it and share it with your classmates. And don't forget to subscribe our channel because the world of biology is here. So see you very soon. Thanks for watching. Bye-bye.